Colby, assistant professor of emergency medicine and medical toxicology at UC Davis School of Medicine in Sacramento. Thought we'd give a quick lecture on disulfiram reactions. Meant to give this lecture quite a while ago, and now we're in the middle of the pandemic and catching up on a lot of work. So I thought we'd finally get to giving this lecture for all of you. So disulfiram reactions, why do we want to do this lecture? I found a couple years ago when I took the medical toxicology boards that they were one of the larger, more tangled, it was one of the larger, more tangled messes of information I've ever had to memorize and learn in my entire life. So much of it seems unrelated. However, the key, in my opinion, to the medical toxicology boards, which are a beast, is finding these threads, these common threads which tie certain seemingly unrelated subjects together. And if you are able to identify these threads and learn from them, you're able to keep at least some of this straight. Even then, it's still a huge amount of information. It's all tangled, but these threads are really important. So disulfiram is one of the, in my opinion, most important threads of the medical toxicology boards. Not just disulfiram itself, but disulfiram reaction and all the medications and occupational xenobiotics, which can cause a disulfiram-like reaction, and even some mushrooms. So all these things connect this common thread of disulfiram. So what is disulfiram? Most of us think of it as antabuse, but it didn't start off as antabuse. It started off as tetraethylthiram disulfide. It was used in the vulcanization of rubber, and they noticed back in like the 20s and 30s that workers developed reactions. Then it was used as an anti-helminthic agent back in the 40s, and physicians developed reactions while drinking. So in 1948, one physician proposed, hey, why don't we use it, take advantage of this side effect, this reaction of this anti-helminthic agent to try to stop people from drinking significant amounts of ethanol. And then it was approved in 1951 as antabuse by the FDA. So actually a pretty old drug. Used to be used far more than it is now. We don't use it as much as it used to be used. It's absorbed as bis-diethyl dithiocarbamate copper complex. So some people have proposed it for copper chelation, and sometimes you'll see some questions about that, but that's not commonly used for copper chelation. So how does this work? Disulfiram and disulfiram-like reactions. If you drink ethanol, you have alcohol dehydrogenase that then makes acetaldehyde, and then we have inhibition of aldehyde dehydrogenase by disulfiram. And because of that, we have buildup of acetaldehyde. That's kind of what makes it toxic, or that's what makes you sick if you drink alcohol, drink ethanol specifically, if you have disulfiram or a disulfiram-like substance in your body. People are often confused and say, oh, I get flushed when I drink alcohol because I have a problem like alcohol dehydrogenase. Not to be a nerd, but when your friends say that at a bar or drinking at home, you can correct them if you want to say, actually, it's an issue with your aldehyde dehydrogenase, not your alcohol dehydrogenase. But I don't know, that joke might not go over as well. It's kind of nerdy. So this is what happens. This is the classic flushing and pruritus that people get when they have a disulfiram or disulfiram-like reaction, or they have a genetic problem with their aldehyde dehydrogenase. You have buildup of acetaldehyde. What happens with disulfiram acutely? You get flushing pruritus, as I mentioned, and then nausea and vomiting. And for the boards, remember the garlic smell. They like mentioning this garlic smell. There's only a couple things that cause a garlic smell, and disulfiram is one of them. People are tachycardic. Large amounts of disulfiram, especially if you drink either a lot of ethanol or if you take a lot of disulfiram as well, you might have pain like in your chest, abdomen, or head. And then people can even have CNS depression with severe enough reactions. And occasionally there's case reports of people with severe toxicity with hypotension, arrhythmia, ischemia, and only a couple deaths with really massive ingestions. Chronically, people who take disulfiram chronically might have hepatotoxicity, and that's kind of the buzzword for the boards is hepatotoxicity. We'll talk more about that. You might have a dermatitis, peripheral neuropathy, and there's some reports of neuropsychiatric effects for people that are on disulfiram for a long time. We think disulfiram inhibits dopamine beta hydroxylase, so you get increase in dopamine and decrease norepinephrine. And over time, that can cause some neuropsychiatric effects. So the hepatotoxicity from disulfiram, this is where your money's at for your test. The boards love this. Central lobular, remember that zone 3 over here on our hepatocytes. We think the estimated incidence for people chronically on disulfiram is about 1 per 10,000 to 30,000 patient years. So it's not the most common thing you'll see, but some countries use a lot more disulfiram, like Russia and Turkey. So they have a lot of problems with this. Versus the United States, not as many people are on disulfiram anymore. So you won't see this hepatotoxicity as much. But the test doesn't care. The test wants to ask you about it all the time. It's probably idiosyncratic hypersensitivity. We don't know for sure. People sometimes have a rash, a fever, eosinophilia, like with other drug rashes or drug reactions, like almost like a DRESS syndrome, but not always. You can also have an isolated hepatotoxicity without those other symptoms. So patients who are on disulfiram, we should be regularly monitoring their liver function. Other disulfiram interactions, it's a known CYP2E1 inhibitor. That's important for the boards. Reduces clearance of amitriptyline, barbiturates, caffeine, chlorodiazepine epoxide, diazepam, and imipramine. It might increase your INR if you're on warfarin. We don't think it affects acetaminophen metabolization. And then there's a couple case reports of catatonia when administered with omeprazole. I think that's silly, and I think it was incidental. But for some reason, some people like asking questions about this catatonia on omeprazole and disulfiram case report. So what do you do for disulfiram if someone has toxicity from it? Acutely, time is the most important thing. You have to have people metabolize both their disulfiram and, of course, the acetaldehyde that's built up, and the ethanol as well, if that's what they took. Fluids, you can use antiemetics, you can analgesics if they're in pain. People propose antihistamines for the flushing and pruritus. It may or may not work. For those really severe, significant toxicity patients, which are rare, few and far between, you could consider pressors if they really were really hypotensive. And then people have proposed flumetazole to be your alcohol dehydrogenase inhibitor, and then you won't make as much acetaldehyde, if that makes sense. It's not been used frequently. There's a couple people who have used it occasionally, but it's interesting. Probably an expensive antidote for something that probably is not necessary, but interesting. Chronically, if you have chronic problems like hepatotoxicity, of course, stop the drug. But we've seen a couple patients, including in Sacramento, that were on a disulfiram implant, which are not used frequently in the United States. But a lot of Eastern European countries, Russia and Turkey, put patients, they give them disulfiram implants, sometimes against their will. Patients don't always consent to having the disulfiram implant. And so if you pick up the hepatotoxicity, they might not reveal that they're on a medication because they forgot or are embarrassed or don't tell you about the disulfiram implant. And so you might need to try to remove the implant, which are sometimes challenging to remove because they're pretty deep in there. But it's kind of an interesting subtlety. So don't forget the implants. People have proposed NAC for hepatotoxicity, like we all do for all forms of hepatotoxicity, and we don't know if that works. So disulfiram-like reactions, and I like being specific with my terminology. So disulfiram reaction is when you take disulfiram and you drink ethanol. Disulfiram-like reactions are from things that are not disulfiram, things that seem to cause a similar effect on aldehyde dehydrogenase. That's disulfiram-like reaction versus disulfiram. Subtle, but I think it's an important difference. So you see the disulfiram-like reactions up top here above acetaldehyde. We'll see some things that cause that. So medications that are associated with it, metronidazole, Flagyl, that's what everyone knows. It's on your step 1 tests. Everyone says don't drink ethanol if you are going to be on Flagyl, metronidazole. We all know about that. It's on all the paperwork we give patients. Pharmacists warn patients. However, here's a cool study where back in 2002, where they gave volunteers Flagyl, metronidazole, and ethanol, and it didn't really cause any effects. Patients did not get a disulfiram-like reaction. So people are now thinking perhaps that the metronidazole disulfiram-like reaction is maybe a little bit overblown. Maybe at a minimum, well, it's possible, depends on the person. Maybe there's some other medications that actually cause more significant disulfiram-like reactions. So the most famous one that you'll need for the boards is cephalosporins with N-methylthiotetrazole, MTT. It's this side chain on cephalosporin antibiotics that is profoundly linked to disulfiram reactions. The one that you have to know the most is in bold here. It's cephalosporin. So it's not one that you're going to be administering or prescribing to many patients, but the boards historically really like this question. So cephalosporin. There's other cephalosporins. Well, it technically can be any of them that have this MTT side chain. So here we have the NMTT side chain at the top. And then in the middle, we have a cephalosporin that does not have that side chain. At the bottom, we have the side chain present. Potentially a structure you might also need to know for the boards as well. So this NMTT side chain is very important for disulfiram-like reactions in the boards. Other antimicrobials, Bactrim. Clinically, that probably has more disulfiram-like reactions than metronidazole and flagyl, but that's not how we educate our patients. So just practically, probably good to recommend to your patients that you're prescribing Bactrim to not drink ethanol because they might have a disulfiram-like reaction. Nitrofurantoin, chloramphenicol, griseofulvin, a couple other meds that might have disulfiram-like reactions. Another one for the boards that you won't be prescribing very much is chlorpropamide. It's a sulfonylurea. It's no longer recommended due to numerous side effects, and the Medical Toxicology Board loves talking about all the side effects because it's one of these famous toxicological medications. It is associated with disulfiram reactions, but you also need to know for the boards it causes SIADH and a lupus-like syndrome. So this is one of those common threads that branches off in other areas. If you know chlorpropamide, you know the disulfiram reaction part, but then you also know about SIADH and lupus-like syndrome. So all these little subtleties of chlorpropamide, and it's these threads that go out that help you keep your mind straight when trying to learn everything you need to know for the Medical Toxicology Board. And we can talk about some occupational reactions. These are also very challenging, I think, in my opinion, to learn for the boards. And if you can figure out any common threads like disulfiram reactions, you can try and keep them straight. So you see disulfiram and then diethyl dithiocarbamate being broken down into carbon disulfide. So we're going to talk about all these different substances and structures. So theorim or thiram herbicide. This is a common question. It's a methyl analog of disulfiram, and it's used as a fungicide, insecticide, pesticide, a couple of different things. It's in seeds, and this classic situation is golfers who have been drinking throughout their entire game, throughout the entire course. Around the 18th hole, they've had enough ethanol in them, and they've been exposed ambiently to enough of this theorim herbicide that they end up with a disulfiram reaction. They're vomiting on the 18th hole, and that's the classic scenario for this theorim herbicide, and it's due to a disulfiram-like reaction. Another one of the more famous ones is trichloroethylene, TCE. It's an industrial solvent that's all over the boards, used in metal fabricating, cleaning, groundwater exposure history when it's been dumped. But what do you get? You get a degreaser's flush is what you have to know about trichloroethylene. That's the number one thing. I might show you a picture of someone with what looks like flushing and pruritus, and it's a disulfiram-like reaction. Trichloroethylene, the other things you have to know about it is hepatotoxicity, which is not surprising given the fact that it causes a disulfiram-like reaction. We already know disulfiram causes hepatotoxicity. And then also famously trigeminal neuralgia. Trigeminal neuralgia and trichloroethylene. Degreaser's flush is a disulfiram-like reaction. Carbon disulfide is another famous one. It's used in the production of viscous rayon, famously. And it's probably, some people are proposing, because we don't actually know specifically how disulfiram-like reactions work. It's not the disulfiram, it's a byproduct, a metabolite of disulfiram, which binds to aldehyde dehydrogenase. So some people are proposing perhaps it's carbon disulfide. Carbon disulfide occupationally with large exposures over many years has been implicated in increased rates of atherosclerosis and coronary artery disease. And that's something you have to know for the boards. It's also a basal ganglia and ocular toxin and a teratogen. But again, because it's on this lecture, it causes a disulfiram-like reaction. So all these things you need to know about carbon disulfide. And if you start with the fact that it causes a disulfiram-like reaction, you can try and remember the rest of it as well. And then diethyl dithiocarbamate, the metabolite of disulfiram. It's used to produce disulfiram and other similar products. And on the board, sometimes you see something called a dithiocarbamate listed, and oftentimes they mean diethyl dithiocarbamate. Diethyl dithiocarbamate, DDC, is a type of dithiocarbamate, to be specific. It's also been used as a chelator for the boards. What pops up the most is nickel carbonyl, also pinoid poisoning and zinc potentially, but nickel carbonyl is the one that pops up the most, and the structure is a common structure on the boards for diethyl dithiocarbamate. There's a couple other occupational products that cause a disulfiram-like reaction. Carbon tetrachloride, it's this old solvent you have to know about. It's an old fire extinguishers, famously. It can convert to phosgene and it causes hepatotoxicity. If you see a question and it asks you a question about anything on this lecture, hepatotoxicity is always a reasonable answer. Anything that causes any disulfiram or disulfiram-like reaction or metabolite or precursor of disulfiram can potentially cause hepatotoxicity. And then DMF and then dimethylformamide. DMF is a pharmaceutical solvent. It's used in acrylic fiber production and recovery of carbon dioxide. And it also can cause hepatotoxicity. But both these things, carbon tetrachloride and DMF, can cause disulfiram-like reactions. And then finally, the thing that kind of makes disulfiram such an amazing common thread throughout boards is we did medications, we did medication side effects, we did occupational exposures, and now we have mushrooms. There's a mushroom that causes disulfiram-like reactions. So Coprinus inky caps, they have autodigestion, so they kind of are eating themselves, and they're edible. They actually taste good. They're kind of unattractive looking, in my opinion. They look like they're melting all the time, but they actually taste good. The toxic metabolite that inhibits aldehyde dehydrogenase you need to know about is 1-aminocyclopropanol. Okay, 1-aminocyclopropanol. That's the answer you'll see on tests for Coprinus for inky cap mushrooms. There's a couple different types, a couple different pictures you might see, different types of Coprinus mushrooms, but they all work the same and they all are technically edible. Again, unless you drink ethanol with them, and then you may or may not have a disulfiram-like reaction. So there's famous dinner parties at fancy people's homes and even restaurants that have been ruined by people using delicious Coprinus mushrooms that then combined with the tasting menu and the alcohol pairing, causing disulfiram-like reactions. So overall, disulfiram reaction take-home points: hepatotoxicity, hepatotoxicity, hepatotoxicity. That's important. Cephalosporins and the NMTT side chain. Clopropamide is all over the boards, and disulfiram reactions is one of the things you have to know about them. The occupational disulfiram reactions, a lot of things to know, but the most important one, in my opinion, would be the trichloroethylene, the degreaser's flush, and of course, Coprinus mushrooms and keycaps. Very important mushroom for the boards. Hopefully that was helpful, and people can always email me any questions they have about this. Thank you very much.